Now, there's danger ahead for thousands of residents in parts of the Volta region affected by the floods caused by spilled waters from the Akosombo Dam, as some of the displaced persons resort to the polluted water for some of their chores. Fear of cholera outbreaks and other waterborne diseases is imminent. Now, the Queen Mother of Sokwe in the North Tongue district of the Volta region, Mamaga Ajesu, is worried the community shows signs of infections and there could be an outbreak soon if the water concern is not addressed immediately.
Water is highly polluted. They have to come to our aid. We went for a meeting on Sunday, and then the MP suggested we use the Akosombo Dam. That one, they will be able to sterilize it. He mentioned some chemicals that is supposed to be bought by the VRA so that they will be able to be opening the tap like intermediately. But as I'm speaking now, the tap is still not flowing. And for weeks now, we don't have flowing water. We need to drink. We need to bath. We need to wash. We need to cook. What are we going to use for all those kind of activities? It is a hindrance to us. We thank God that we haven't had any casualty of death. But what I know is there are snakes and then other kind of this thing in the water. Some even when they touch your skin, the worms and then it wouldn't have effect now. Maybe after some time before they will see the effect. My fear is maybe after this, then the sicknesses will come up because when you drink it right now, you will not have effect. But for weeks or months before the effect will start coming up.
Now, District Chief Executive for North Tongue, Divine Apenu, tells my colleague Winston Amwa that the local health authority is collaborating with personnel from the Ghana Medical Association to undertake screening of all those affected by the flooding in the communities.
Currently, we have people, about 14 safe havens across the district. And the point is that leaving your home and then moving to a different place, definitely there will be some form of discomfort. But I think that we are managing the situation very well with the assistance of the Ghana Health Service and all other stakeholders.
Let's focus on the health impact. So far, how are you dealing with that?
We've been able to establish these mobile clinics and most of the savings, and screening has started. Some medical staff are placed there. We have also created an isolation center at the Batokali Hospital to take out those who might need to be isolated. So it's going on well. Yesterday, the Ghana Medical Association, DMA, and some other, in a sense, some medical team who are joining the team currently to ensure that all the CVVs have medical team. And I think that one challenge that started initially was that people do not have their health insurance cards have been washed away and all that. So, but the directive has come and they are treating them free now, and things are going on smoothly. The information I picked from the health director this morning indicates that they've been directed to do screening for everybody. So they will start this morning at the various safe havens.
Do you have enough relief items? Are you able to reach all of these persons in these safe havens?
Yeah, so we currently are giving enough relief items to our people. Here at the assembly where we have the emergency operation center working together with the district disaster management team. That is where we receive all official donations that come. I must say that Mokwe is the hardest hit though.
Now, MPP Member of Parliament for Dormaa East, Paul Chimberma, is calling on the Speaker of Parliament to urgently reconvene Parliament so that the House can offer strong support to victims of the floods in the Volta and other regions. For almost 2 weeks now, several communities in the Volta region have been submerged following the spillage of the Akosombo Dam. According to Paul Chimberma, the House should be recalled so that it can offer support to the victims who are in dire need of help.
obviously over 26,000 people being displaced. It's quite a lot. I hope we can quickly attend to their needs. As a parliamentarian, I believe that Parliament will reconvene as soon as possible for us to quickly maybe go there to see things out, and also, if possible, see what we can do to help them in difficult times like this. So I think I will call on all meaningful Ghanaians who have the world, have the means to support their fellow people at this time. This is a time that you should show your true citizenship. It's not at the time that we are going to flaunt wealth and all that. This is a time that we want to see the Ghanaian in you. This is a time what we say, be a citizen, not a spectator. This is when it comes to play. So I will urge all my colleagues and other people to see how we can all come in together. Myself, I'm putting myself together to make sure that I think one radio station is doing some support, and we will see how we can add our support to them and help our colleagues. It's unfortunate, but we always say that, I mean, we give thanks to God for not taking out their lives, but rather preserving them for us. But let's see how we will come together to ensure that these people are properly reinstated, or we are able to bring them back to their normal state. I think it is important, because waiting for 31st, obviously, there are a lot of people sleeping out. There are a lot of people who have nothing to eat. There are a lot of people who are drinking bad water. So it is important we reconvene as soon as possible to take decision on how we have to support these people. So obviously, an emergency sitting is not out of place. And if it's possible, I support such a call.
Now, on calls for the president to declare a state of emergency, Paul Chumberima believes the government must be allowed to assess the situation and take that decision.
I think the Interior Ministry will have to give us a proper assessment to see if we are there yet. And at this point, if you look at the Interministerial Committee that has been set up, it's a high-powered delegation, and therefore it's a high-powered committee, and therefore I think it's important that we allow them also to do their things and see where they can take us.
Let's take you to one of the safe havens now, Azizanya, where my colleague Carlos Coloni is standing by. Carlos, so throughout the day you've been with the Vice President's team. What can you report for us as of this time that we're speaking to you?
All right, Bray, so we are currently at Azizanya DA Basic School in Dormaa East District, one of the centers that is actually being used as a safe haven for flood victims from 4 communities, Azizakpe, Kewuno, among others. And this particular center is holding about 395 persons, including these kids that you can see in your picture. A number of kids are here, and as you can see, this is their condition. And those I've been speaking to have been telling me since this incident started, and they've been holding them here, they've not been able to go to school. And so I'll be speaking with this woman here to tell her details. So how long have you been here?
From Sunday. Sunday we have come here. So is it 5 days now we have here?
So we see the number of people here, 395. Do you have enough space to sleep?
Yes, please. We are be sleeping.
Okay. And how is this situation affecting you going to school?
Through the way from Aibo to the school, there is flood over there. So yesterday when I'm coming to school, I have to remove my shoe and socks before crossing the water and come to school to learn. And yesterday, when the rain falls too, there is a lot of flood on our park. So after school, I have to remove my things again and fold my dress before crossing the water.
So you are currently at this center, but you're still going to school in your community?
Yes, please. No, not in my community. At this place. At the 4RC Basic.
Okay, all right, thank you. So, Brace, as you can see, these are the flood victims in the Dormaa East District, and this is Azizanya. These are live pictures, and these are the conditions of the people. A lot of children here, but the good news is that the Volta River Authority has just donated some medical supplies to them, and as you can see in your shot, some fruit juice and biscuits are going to be shared to these kids here, and they have been raising concerns also about their safety with regards to mosquito bite and all that. You can see this young one in your shot there, and many of them here, 395 at Azizanya DA Primary School in the Dormaa East District. This is one of the many safe havens across the 8 affected districts. This is just one of them. So this mirrors the situation across these 8 districts, part in the Volta region, part also in the eastern region. So, Brace, that is the picture. And if you look at the extreme there, you see a number of them, women, children, the aged, and some with babies, all of them here carrying their babies, as you can see in your picture. So that is the story, Brace, from Azizanya DA Basic School.
Carlos,
here at
you made mention of
East District.
Mosquito bite. What about the supply or distribution of mosquito nets?
Indeed, so they have been saying that they have been supplied with some mosquito coils, but the fact that the rooms are not that spacious and they don't have what it takes to hold this mosquito net, they have resorted to the use of the mosquito coils, and so that is a bit of a challenge to them, which is actually exposing them to mosquito bites. So I would want you to briefly look at the situation so you can appreciate the conditions here. So this is one of the rooms where they sleep, and you can see, even though you can see some mosquito nets there, largely across this particular room, which is serving as their sleeping place, they do not have the luxury to fix mosquito nets. So they heavily are relying on these mosquito coils in order to sleep. But still, according to them, if you know, this place is very close to the sea, and so they say they still face the issue of mosquito bite, which is exposing them to a lot of danger. So this is the picture from Azizanya Basic School, Brace.
Oh, all right, grateful. I mean, let's extend support to them as much as we can.